Hello, everybody. I'm Namita Thapar, Executive Director of MCure Pharmaceutical. And on today's episode of Uncondition Yourself, we bring to you a very important topic, skin health and cosmetology. To share some statistics with you, 40% of women suffer from acne, 20% from eczema, and 4% from psoriasis. Not a lot is known about the causes, treatment, prevention of these basic skin conditions that are so prevalent. We're also going to talk about cosmetology, which is a very, very increasing trend, not just in big cities, but even smaller cities in our country. With that, let's talk to our two experts. We have Dr. Trasi and her lovely daughter and Dr. Shefali. Thank you so much for joining us today. Let's start, Dr. Trasi, by talking about the very basics. Can we speak about acne, eczema, psoriasis? At what point does it happen? What are the causes? And what's the best way to both prevent as well as treat these three conditions?
Thanks, Namita, for inviting me.
Thank you.
For such a good topic, like uncondition yourself. It's very important. It's not only for a beautification, but in skin also.
Yes.
Let's start with simple acne, which is a common thing in our practice. The mothers get a young daughter and say, उसको थोड़े मुहासे हुए हैं, but कुछ भी मत दो. But they don't realize कि if you don't treat the pimples or acne, so called, at an early stage, that same girl is not going to get bad acne in future. Then they heal with scars, and which gives them lot of mental stress.
Correct.
So in short, pimples or acne can come at a very early age, because nowadays we get menarche at very early age. I have seen girls getting periods at the age of 9 and 10.
Right.
So that is the time they start getting acne. And we are very conscious. So we apply makeup. Those young girls apply makeup. They use any conditioner, any face wash. That itself leads to getting pimples.
Right.
Junk food, using anything, eating junk all the time, having lot of chocolates, that also gives rise to acne. So young girls come to us with pimples. They should be treated in time, properly, because we have simple things which will control their acne. Then comes middle age, lot of stress, managing housework, managing profession. Now because of the hormonal imbalance, I see acne even occurring at a perimenopausal stage, wherein 40 years back I would tell them, अरे pregnant हो जाओ, pimples नहीं आएंगे. But now I see pimples coming at any age. Again, our makeup, wrong eating habits, all that leads to acne. So we need to treat them right at right age, at every stage. Now coming to eczema, 20% of the people get eczema. In Gujarati they say kharujvu, and they always think kharujvu तो ठीक नहीं होता है डॉक्टर, ये तो हमारा खानदानी बीमारी है.
Oh, God.
It's not such. 30 to 40% of the cases, it is definitely genetic. So they are not always wrong.
Right.
But now we have treatments. And then lastly, you said psoriasis.
Yes.
See, psoriasis is scaling on the body. All the time you are getting scaling patches. I have a patient who will explain you all.
Yes, yes.
So those scaling patches can occur on the full body. It occurs on the scalp. It occurs on the palms and soles. And when some person with bad psoriasis is sitting there, his scales are falling on the ground and all.
Right.
So people are scared of them. Arey, this is a contagious thing. मुझे भी इससे लग जाएगा. So, and they don't want to sit next to you and all.
And none of these are contagious.
And
That's
again,
the most important
exactly.
fact.
And people think कि अरे नहीं डॉक्टर के पास जाएंगे तो वो स्टीरॉइड ही देंगे. That's again wrong. ये psoriasis के लिए we have medicines. We have very advanced treatments. Few are expensive, few are cheap. So you can manage according to the pocket of the person.
Correct.
But
Is
when-
psoriasis also genetic?
Yes, partly genetic. So I have seen generations having psoriasis. Grandfather had psoriasis. So when we sit with the patient, we tell them कि ये psoriasis ये सिर्फ चमड़ी में नहीं रहता है. It can involve your heart, it can involve your joints. So after some time, you will see that the patient is limping and coming to you.
Oh, really?
And I have seen patients even trying to commit suicide.
Oh.
They need to be counseled. They need to be sent to psychiatrists to manage them because they can't attend party. उनके हाथ पे पूरा scales है, fissuring है, knuckles पे है, joint ये है. So they shy away from the
How
society.
do women live with this level of trauma and social judgment?
Because they just shy away from occasions. They sit at home. If there are guests in the house, they'll not come out in the hall. And the husbands and relatives also don't want them. They'll say, "अरे तू अंदर काम कर रही है, अच्छी है, खुश रहे." And that is where I thought कि जैसे हम आदमियों को अहमियत देते हैं, we say they are important. They will run to the doctor and take treatment. But the wives will be set at home. The daughters will
Very
be
true.
prevented from going to social gatherings. We have to tell them this, come out. There is an answer.
And in fact, Shefali, perfect timing to switch to you and ask you about a growing trend in our country, cosmetology. So, I mean, I know it covers a whole range of therapies, whether it's Botox and fillers, vampire facials. Can you tell us more about what are the various treatments available, and does it really have side effects? Because a lot of us feel like, oh, does this have side effects, and how often do you need to do these?
So cosmetology is an array of multiple things. You can even include treating an acne scar as a part of cosmetology. You can even include the pigmentation caused after psoriasis, lichen planus as a part of cosmetology. We have machines such as lasers, we have technology such as peels, microdermabrasions to take care of these telltale signs of skin problems. Only thing is, it's a big array. So it depends upon what the patient wants. If a patient comes to me with acne scars or acne pigmentation, post-acne pigmentation, I will limit themselves to certain basic creams, like basic treatments like the peels and the skin polishing. If it's still not, it's still very rough, if the scars are too deep, too resistant to treatment, then probably I'll step up to lasers and microneedling, radiofrequency, all that. When a patient comes to me for a routine rejuvenation, nowadays it's a very good topic that people do come to us for a very basic skin rejuvenation. They want to look their age, or they want to look a little younger than their age. So in that case, I can definitely do treatments such as a laser resurfacing, something called as carbon peels, skin boosters to promote your own hydration of the skin, or as you said, vampire facials.
What is a vampire facial?
It's nothing but a concoction of growth factors which I take from your own blood and inject it back into your face. What it does
is that painful? Because it sounds painful.
No. It's not that painful, of course, because we do apply a lot of numbing cream. A good local anesthetic cream is applied on the face about half an hour prior to a procedure. And then as soon as the concoction is ready, we inject it on their face. If the patient still is very sensitive to pain and doesn't want to do that, there are various techniques to inject or put in those that serum onto the face. So that's what a vampire facial is.
Got it.
Then coming to the anti-aging, Botox fillers is the commonest.
Yes.
Nobody can beat that. But there are skin tightening instruments such as monopolar radiofrequency. There is ultrasound, that is high intensity focused ultrasound therapies, also commonly known as UL therapy. So multiple techniques.
And these are non-invasive.
Yes.
Completely
yes.
non-invasive. So then first is non-invasive, then comes the semi-invasive, that comes your Botox and fillers.
Got it.
And thread lifts. So threads are also gaining a place in Indian markets because initially not many threads were available, and only the Korean threads were available and beautiful working. But the amount that they put in their skin and what we put in our skin, there's a huge difference.
What are threads used for? Sorry, which parts of your body?
Skin laxity.
Okay.
I have a lax skin, not too much, then that becomes a plastic surgery patient. So if the skin is not too lax and can be definitely improved, then thread lifts are one of the very good treatments that have come up.
And the most common would be for sagging breasts, of which other areas?
I do it for face, all over the face.
For face.
Eyebrow lift, for
Okay.
neck, because
Okay.
of the crinkling neck lines which
Okay.
can develop. We do it for sagging breast. We do it for post pregnancy abdomen, for
Okay.
lax thighs, when sagging of arms, but not, it's a combination of multiple treatments together.
And this is you have to be hospitalized for this?
It's
or-
all these are daycare procedures.
Oh, really?
Yes,
Patient
yes.
comes in, it might take half an hour, 1 hour, 1.5 hours, 2 hours max, and the patient walks out.
Oh, wow.
And coming to side
That's
effects,
some advancement.
Yes. yes.
coming to side effects, when done any procedure properly, there are no side effects. There are times when we tell the patients, you know what, let's wait at this.
Exactly.
You get used to the result, you like it, good enough. If you still feel that you need to put in more Botox, erase the lines more, then come and we will erase it for you.
She's absolutely correct about this. And I totally agree what she said, because I am one of them where she's told me, wait, when I go to her, I'm very impulsive. I want to do this. She said, relax. Let's go step by step.
And in fact, Sonali, let's talk about your story a bit, because when I look at you, I cannot tell that you've got anything done. I mean, hats off to you, Shefali. But when we spoke, you've had a decent number of things done. What have you got done?
I've done, I think she's mentioned all the things like a Botox or a filler or a thread.
Okay.
I have done all
And at
of
what
these.
age did you start doing this?
I started at 40.
But is it because you felt you wanted to look younger? Was that the reason?
It is about the confidence facing the world. It's not looking younger. Definitely you look your age.
How often do you go for, your fillers and your Botox? Is it once every 3 months, 6 months? How
I
often?
think fillers is last year, 1.5 years.
Oh, really? It stays
Yeah,
for that
yeah.
long?
Yes.
So basically, I feel it is not about age factor, or it is what age you start, or people are judging about all this. Honestly, I have not faced.
Even today, I have seen incidences where one girl comes doing some treatments and her friend happens to come to my OPD. She'll say, "Doctor, जरा मत बोलो ना, मैंने कुछ किया है, बोले मेरा सब natural है." So that is still there in
That is
India.
still there. They still don't want to talk about
Exactly.
it. But that's some level of almost self-deception,
Yeah. So that is
hypocrisy.
why we are here. So that, see, it is not unnatural.
With this, I'd love to speak. We're speaking a lot about confidence and myths and taboos. अंकिता, आप आपकी कहानी बताइए. आपको सोरियासिस हुआ है और कितने साल के थे आप जब ये शुरू हुआ?
मतलब मेरा नाम अंकिता है, मैं भाईंदर में रहती हूँ. मेरी शादी को 10 साल हो गया और मुझे 8 साल का बेटा है. तो मुझे है ना, शादी के बाद सोरायसिस हो गया.
ओके.
पहले मुझे कुछ नहीं था मैम, शादी के बाद मुझे हो गया सोरायसिस. तो मैंने बहुत सारी दवाई की, एलोपैथिक, होम्योपैथिक, मुझे इसमें भी फ़र्क नहीं पड़ा. फिर मेरा पैसा भी बहुत गया और कोई मेरे पास आने को भी नहीं चाहता था. मैं मेरी बेटे के पास भी नहीं जाती थी, मुझे डर लगता था शायद मेरे बच्चे को भी हो जाएगा, तो इसके लिए मैं मेरे बेटे के पास भी नहीं जाती थी. मैंने बहुत दवा का खर्चा किया, मुझे कुछ फ़र्क नहीं पड़ा. मुझे पूरी बॉडी में हो गया था सोरायसिस. फिर मेरे हस्बैंड है, उसके फ्रेंड की वाइफ ने मुझे बताया कि खार में डॉक्टर त्रासी मैम है, वो डॉक्टर बहुत ही अच्छी है, तेरा पूरा क्लियर हो जाएगा. तो मैं उनके साथ में गई क्लिनिक में. तो मैंने इसको बताया मैडम को मुझे पूरे बॉडी में सोरायसिस हो गया है, मैं बहुत सारी दवा किया, मेरा कुछ फ़र्क नहीं पड़ रहा है. तो मैम ने बोला मैं तेरी दवा चालू करूँगी, सोरायसिस में फ़र्क पड़ जाएगा. फिर मैंने ट्रीटमेंट चालू कर दिया मैम का. तो उसमें मुझे इंजेक्शन लेने को बोला था, 10 इंजेक्शन और गोली भी दी थी. तो मेरा सब चालू ही था रेगुलर. पर एक कोविड आ गया तो मैं जा नहीं सकी क्लिनिक पे. तो मेरा 7 इंजेक्शन हो गया था. उसके बाद मेरा 1.5 महीने का गैप पड़ गया, मैंने इंजेक्शन नहीं लिया. उसकी वजह से मुझे पूरा बॉडी में सोरायसिस आ गया.
ओके.
फिर मैंने वापस ट्रीटमेंट चालू किया.
अंकिता, लेकिन तूने साइकेट्री दवा भी ली ना? साइकेट्रिस्ट की भी दवा अभी चालू है ना तेरी?
हाँ, अभी चालू है दवा मेरी. मेरे को डिप्रेशन आ गया,
डिप्रेशन
सोरायसिस की वजह से मुझे डिप्रेशन आ गया मुझे. तो मेरी अभी वो भी ट्रीटमेंट चालू है. अंधेरी का डॉक्टर है, उसका ट्रीटमेंट चालू है. तो वो भी मुझे गोली लेना पड़ता है.
आज तो आप बहुत पॉजिटिव लग रहे हो.
अभी फर्क पड़ गया है ना सोरायसिस में. देखो
इधर का
इधर
हाँ, यहाँ दिख रहा है
यहाँ दिख रहा है स्केलिंग.
करेक्ट.
ये सब मुझे फर्क हो गया. देखो इंजेक्शन भी चालू है और गोली भी चालू है.
लेकिन ये लाइफ लॉन्ग, she'll have to take it life long?
नहीं. See, first we have to control them with injection because it is extensive. I want to prevent her from getting joint pain. उसके सांधों में दर्द नहीं होना चाहिए,
हाँ,
उसका
अभी
हार्ट
सब-
को असर नहीं होना चाहिए. इसलिए पहले मैं इंजेक्शन दूंगी, गोली दूंगी, और फाइनली कंट्रोल में आने के बाद एकदम सस्ती गोली में और मॉइस्चराइजर में उसका काम चल जाएगा. 10 मिनट का सनलाइट, मॉइस्चराइजर, सस्ती गोली.
अभी आपके पास वो कॉन्फिडेंस है कि आप बाहर जा सकती है, सबको मिल सकती
हाँ,
है, बेटे के साथ खुल के खेल सकती हैं?
खेल सकती हूँ. हाँ, अभी तो कोई टेंशन नहीं है ना.
अभी कोई टेंशन नहीं
नो
है.
टेंशन, अभी टेंशन फ्री.
अभी हस्बैंड के साथ भी रहती है. मैंने वो बोला, वो भी सब कुछ कर सकती है जो नॉर्मल लड़की करेगी.
करेक्ट.
क्योंकि
करेक्ट.
psoriasis means they don't go near husband, they don't have sex life.
राइट.
So we have to sometimes teach them that, and we have to call the spouse,
Absolutely.
and fortunately her husband is very understanding.
Wonderful.
मेरे हस्बैंड भी बहुत अच्छे. मेरे हस्बैंड बोले जितना खर्चा होगा अंकिता मैं करूंगा, पर तू तेरी ट्रीटमेंट पूरी करना. अभी ये ट्रीटमेंट बाकी मत रखना, 10 इंजेक्शन लेना ही पड़ेगा तुझे.
Oh.
मेरे हस्बैंड बहुत अच्छे हैं, बहुत अच्छे हैं मेरे हस्बैंड.
But I have
That
to
is so
convince him
nice.
that this
बहुत
is
support
not,
करते हैं
see, this is very important कि ये contagious नहीं, because then That is one of the reasons also for
Absolutely.
depression.
You know, that whole myth about contagious. That's why people don't
They
go
have
meet
not
them.
had a relation for years together because she has psoriasis. So that also many
you have to
times I have
counsel the husband as
कि
well.
नहीं बाबा ये कुछ नहीं होता है. Even if she has it on the body, you will not get it.
Okay. And other than genetic, what could be the causes for psoriasis?
I always tell patient GOK. God only knows why our own body,
GOK.
our own body is stimulating our cells to multiply much faster. हमारी skin 10 या 15 times multiply हो रही है, लेकिन it is not getting shed off. इसलिए वो जम जाता है. इसलिए उसको सोरा माने इच बोलते हैं. अब्रक जैसे स्केल्स बॉडी पे आ जाती है.
और चमड़ी भी बहुत गिरती थी मेरी स्किन पे से. जिधर भी मैं बैठूंगी ना उधर ही चमड़ी गिर जाती थी पूरी. ऐसा होता है, बार बार मेरे को झाड़ू निकालना पड़ता है घर पे. ऐसा अभी तो ऐसा कुछ नहीं होता है. पहले मुझे बहुत ऐसा हो गया था.
Skin has always been the last thing that comes in
Yes.
a person's mind. It's a completely last thing, be it acne, be it skin rash. You know, everyone tries all homemade
Homemade
nuske,
things.
everything they try, and then they come to us. I would just like to say that skin is your largest organ of the body. Just take care.
Correct.
That's a very
Absolute.
important
That is
fact. Very important
The
fact that
largest
people
organ on the
forget.
body is on your body is skin. 80% of it is skin.
Thank you so much for sharing such important information with us. And with that, we end another episode of Uncondition Yourself. Please remember what Shefali said. Less is more. Do what's necessary, do what's important. Very, very important what Ankita said. A lot of her trauma could have been avoided had she educated herself and known about some of these myths. So get educated, learn the important facts, stop judging, and most importantly, don't let anyone else hold the keys to your happiness.
अपनी उजली इल्ली ने मन में ठाना है, बन के उड़ना है तितली. दायरे लांघ के ही तो जीना आया मुझको. मैं बदली बदली